HAICU is based in the Office of the Vice Chancellor. We were originally an HIV and AIDS unit since '94. Because of the context around which HIV is spread, our work has covered intersectional issues of race, gender, and sexuality. I think what HAICU offers the university is we can take an issue and break it down in terms of how to handle it in a holistic way. So we can work out what is the way to address this from management's position, what do staff need to be looking at, what is a co-curricular piece, what is a curricular piece, what is a policy piece. And because we've looked at issues such as sexuality or gender-based violence, other transformation issues in that holistic way, we have that experience of liaising and of consulting and of breaking things down in a certain way and of evaluating whether we're effective. And I think those skills can be applied to several transformation issues. And I think that's a rare thing that a unit has, a group of people with skills that are transferable to other transformation issues. So one of the main areas of our work is around policy. So we coordinate the HIV policy implementation group, and we're also very involved in drafting and will be involved in policy implementation and monitoring of the sexuality policy. Another aspect of HAICU's work is around curriculum collaboration. So we make sure that academics who may not have the skills to teach students around HIV, race, gender and sexuality have someone that they can collaborate with so that their work can be current and relevant and discipline specific, so that our graduates do leave UCT able to understand why these issues are so important to society.
HAICU works with students in each faculty that has an integrated curriculum, bringing in the social science discipline into engineering, commerce, humanities, as well as sciences. So for the Faculty of Humanities, we work really successfully with art students who use their craft to respond to social issues, not only by raising awareness, but also by providing peer discourse and educating others about their work. So the Faculty of Commerce, we work with the Raymond Ackerman Academy, and the students from this academy are unique in the sense that their focus is on entrepreneurial skills, not only business entrepreneurship, but social entrepreneurship. So they are already motivated to start responding to challenges affecting South Africa. So one example was a student who from our lecture with them, from HAICU's engagement with them, he understood that access to medication was quite difficult for the labor force. So the student took this challenge and he went back into his own township and community, and he created a delivery system for the medication. In the Faculty of Engineering, we worked with students who cut across the engineering faculty, so construction students, engineering students from Mech Eng, Chem Eng, and they came together and responded to the issue of how does HIV/AIDS affect the engineering industry in South Africa. And collectively, they went away and researched the content and then came back and worked with HAICU on formulating this content into a project proposal that ultimately resulted in a sculpture that we wanted to place on the UCT campus.
At the time, I was already fairly involved in a variety of projects that were quite interdisciplinary in nature. So it was intuitive for me to want to work with people from different disciplines because I understood that there is value in that. It doesn't necessarily mean that I have to capitulate my engineering knowledge or engineering background, but it does mean that there should be a willingness to be creative and engage. So at the time it was extremely useful to work on an interdisciplinary project with people from different faculties.
In the Faculty of Science, HAICU works with the environmental and geographical science students in third year and master's level, and we apply the concept of community adaptation and methodologies to the issue of climate change and vulnerability. And again, this process is very important because the methodology is based in the social sciences. The focus is on engaging with communities to understand land hazards, environmental hazards, how the community's practices are adapting to weather and flooding or sanitation.
UCT has developed a number of short-term international programs. HAICU runs one of these programs in collaboration with Johns Hopkins University. Students are here for a 6-week program where they have both an academic component and an internship component. The students learn about different aspects of HIV through various researchers and partners and stakeholders in the field, which they ordinarily wouldn't have had. Then they use these learnings from the classrooms at their internship sites.
So we're here for 7 weeks in Cape Town altogether. We're taking a course on HIV and how behavior patterns in people affect their transmission, their treatment and prevention matters in getting the disease itself and how it can be controlled. We've learned so much in this class, from just the social aspects, the physical aspects, to what affects people and how they get their treatment, why they get it, why they don't, how it affects their family members through their communities, and just everybody around them.
We've been coming to University of Cape Town to do this program, and for the last 2 years, HAICU has been a partner in executing the program and planning it. So they have helped us with delivering the course and with helping the students find and maintain their internship placements. And for the last 2 years, our students have had a real higher standard in how much they learn, because the people at HAICU are so well respected in the field of HIV. They have done so much good work in their prior careers and now here with HAICU, and really know everyone in the field, and have developed a network that they expose our students to and that our students can learn from and take advantage of.
Yeah, so I'm currently working at Yabunga in Kailicha with youth between the ages of about 9 to 20 and gap year students as well. And it is just incredible the type of people that I've met here. Their smiles, for one, brighten my day, and just to see that the constant struggle that they go through on a daily basis between their living conditions, their health, and just the atmosphere around them. It's really nice to have an impact on these children and also have knowledge in the background of HIV to help them get to a place where they need to be.
The reason why working with HAICU rather than any specific faculty at UCT has been beneficial is because HAICU is kind of an overarching, kind of all-inclusive staff here, and they, instead of just focusing on one field, help our students get to know more about the humanities side of things, the social sciences side of HIV, the natural sciences side of HIV, and also the career kind of counseling, professional development side that our students are interested in. If we went to any one faculty here at UCT, we would be focusing on only anthropology or only humanities, and we wouldn't get the kind of all-inclusive, holistic look at everything that everything that reflects HIV.
So HAICU not only facilitates the Johns Hopkins program, but through this partnership we generate funds for the university for the implementation of international programs. Johns Hopkins is one of many programs that HAICU is running and continues to develop partnerships with international partners.
HAICU also run a co-curricular project where we select and train peer educators to give workshops around intersectional issues of race, gender, HIV and sexuality. And the peer educators do workshops in Orientation Week, and we also work with programs such as the DEL program and such as the MasterCard program.
So HAICU coordinates a peer education program known as ACEs. And ACEs in full refers to AIDS and Change Educators. So the ACEs are UCT students who are selected to take part in a peer education program. And by peer education is, what I mean by that is a program in which they teach their fellow students about issues related to HIV/AIDS awareness about the intersectionality of social justice issues and transformation, issues specifically around race, around class and sexuality.
Even though I'm doing medicine and we get taught about HIV and AIDS, but some of the things you never get taught about. For example, they can teach you what AIDS is and how to treat it, but they never teach you how to interact with someone who has HIV outside the consultation room. So being an ace for me, initially I thought it was just gonna affect me as a student, but then I've realized as the years gone by that it actually didn't just help me as a student, but it helped me grow towards my friends and my family as well. So the skills that I learned during an ACE, like conversational skills and non-judgmental approaches, and also with issues such as gender-based violence and gender-based issues, like I became comfortable now in engaging with people. So not only people on campus, but also people at home. When I go back home, I'm able to have these chats with people and educate people.
Through applying for this, the HAICU process and actually being an ACE, it has taught me to be more open about who I am and also to be more consciously aware of what's happening in society, and it has developed me as an individual. So I think as a university student, you want to use that 4 or 5 years in university to develop yourself and to just make sure that when you come out, you are well equipped for the workplace.
What does HAICU do for the LGBTQI community in the institution?
There are 4 ways that we try and assist and support LGBTI and MSM and UCT, and it's basically through 4 strategic areas of curriculum, co-curriculum, research and policy, and finally health and communications. So what that means essentially is we're trying to create a homonormative environment within the lecture space that students can identify with. Secondly, in co-curricular, so also looking at resident spaces. How are we reframing the discussion so that we are teaching issues of inclusion and diversity? Piece of our research and policy is where the sustainability of the institutional response lies. So because we have such a mobile population in our students, we need to ensure that programmatically a policy is embedded in the institution that sustains the thread of a homonormative, inclusive environment. The 4th piece around health and communication also speaks to inclusion. How are we ensuring that the UCT space is not prescriptive or heterosexist? What is our imagery used? What terminology is being used? How are marketing communications shared that are not exclusionary or marginalizing populations further?
HAICU have been involved in coordinating specific umbrella events that relate to transformation. For example, we've done big events around masculinity, intergenerational trauma, and the female condom. And we bring together researchers, lecturers, and students at the university, especially people who are involved in social responsiveness projects, to learn from one another and to share their experiences so that UCT have a better outcome around these issues.
Gather stakeholders at the university, so researchers, people who develop the curricula, people who work in the co-curricular area, and look at how should a higher education institution respond to masculinities with all its intersections around race and class and age and sexual orientation and issues like violence and HIV. And so that we can have a curriculum that is responsive to the issues of society. And so we came together to discuss the issues and then what does it mean for our research agendas and for our curriculum areas, that we could learn from each other and understand some good examples of curricula that had already been developed and used, and people could contribute to that, and so therefore widen the reach of those curriculum areas.
Physical intimate partner violence, highly prevalent in South Africa. A third of women reported victimisation. Almost all of those women had reported multiple episodes of victimisation, and 13% had reported it in the past year. That's from Haoteng. And between 43 and 50% of men had reported lifetime intimate partner physical violence, with about 10% having done it in the past year. So we see quite close concordance between reports from men and women, which is a good thing because that makes us sort of have a better grasp on the validity of the findings we're looking at. We're increasingly getting a handle on, what it is that we're dealing with, and I think that for the purposes of being able to develop interventions, I think we have quite robust data now, and we certainly would argue that we know enough about the size of the problem to start dealing with it.
My colleague Stella Kiobula-Mokoz and I taught about a man who talked about apologising to a woman for rape and what did that mean to be aware of what he'd done to this woman's life.
Okay, so HAICU was involved in developing a curriculum for art students, both in first and third year, and at the conference we presented the outcome of the project. So what we did, and the objective of the course with the first and third year students, we got them to engage with the concept of masculinity through art as a medium. So we gave input lectures for the students around different areas of masculinity and how this notion of masculinity puts people at risk for HIV infection and HIV transmission. So some of the students chose to specifically highlight what kinds of masculinity exists on campus and wanting students to engage with the piece. So when students walk past on the campus looking at these icons, students stopped and asked, what does this mean and how does this relate to HIV? So at that point, students were able to educate other students about, if we understand the notions of masculinity, we will be able to understand how these notions place one or individuals at risk for HIV transmission.
HAICU, HIV/AIDS Inclusivity and Change Unit, decided to tackle this issue and break the silence by hosting a gender violence event in the Molly Blackburn Hall at UCT. The event allowed students to interact with various art pieces that opened the platform around issues around gender-based violence in South Africa. Students were given the opportunity to engage about their own experiences and begin to break down the barriers of shame and stigma.
To me, at first I didn't understand the relevance, but then when I started reading everything and I started writing, then I was like, wow, like we all share something, because it happens daily that you kind of immune to it. Like someone whistles at me, I'm like, okay, what ifs. And then today I really thought about it, that now I understand the relevance of it.
And you're made to feel like an object in your space, and you shouldn't have to be.
There's definitely a place for exhibitions like this. It definitely is something that many people live with, and UCT is a place where you do get judged on your physical appearance and on your race, on your religion. So it definitely is good for there to be awareness of what people experience.
It also brought up for me that, like, as female, we are treated differently in like the world we live in by men. So the posters told me that, like, we can stand up and see, like, and say what we feel and how we feel, so that men can see that we don't like what's happening and we want to make a change and we want them to stop what they're doing.
This kind of program is important at a university, I think, is twofold. There's an enormous amount of violence against women that happens on college campuses. And so we need to intervene. But the other is that we have young people at a time when they are beginning to explore what it means to have intimate partnerships to have intimate partners, and to have that kind of relationship. And we have an opportunity when they come to campus to shift their attitudes, to shift their behaviors towards something that is empowering for women and for men, and then to send them out from university with what I would say are appropriate attitudes for our society, not condoning violence against women and actively combating it. And if we can do that, then we are working with our primary community to transform it.
We held a conference on reconciliation, intergenerational trauma, and higher education institutions. We brought together 3 themes. We looked at acknowledgements and apologies for political violence. We used a case study from Nazi Germany. And then we asked the question, have we had enough acknowledgement, apologies and discussion about what really happened in South Africa? And we asked, what is real reconciliation? What is real remorse? And then we're asked, what do we as higher education institutions have a role to do? Because universities are the ideal space to ask these questions, but also to support students in this process and to have acknowledgements and apologies and encounters, and to create healing spaces both within the classroom and outside of the classroom.
There is a need to be able to create a cadre, as it were, of your mediators. So people are going to be advocates for what the center is about, what the unit is all about. It's critical to be able to do that. But there's a reference to systemic, and I want to be able to say everything that we're doing has to do with the human being. So what becomes important is to be able to look at the whole person. So we don't just deal with matters to do with body. We also need to be able to say, what are we doing at a mental level? Are we engaging the mind to a point where they're able to take care of things for themselves, not to be able to have things done for them, but for them to be able to take care of things for themselves.
Every one of HAICU's projects has been evaluated. Some of them have been externally evaluated. So we can demonstrate that the outcomes are proven. So from very different kinds of projects, whether they be curricular or co-curricular. And we hope to continue the work as the growing needs in transformation are developed and defined. We hope to be the unit that collaborate with other sections of the university around the needs. I think our location in the Office of the Vice Chancellor has meant that if there's a big transformation project that needs to be put together, recently we've been involved in the Employment Equity Plan because there was concern that there would be a delay. We're able to harness our skills and apply ourselves to a very specific transformation project.